Hello everyone. Today here we are going to discuss about comfort devices. Here in this slide we'll see about the comfort devices. Comfort devices, why it is important and why we are studying. What are the importance for the patient purpose? Why we need to use comfort devices. Here we will discuss. So let's start the video. Comfort devices, which is important for both BSc and GNM in their first year. So what is the meaning of comfort? First we'll see about the comfort. Comfort is the absence of irritating stimuli that distract one's attention from the task at hand. So what is the meaning of comfort? Where any irritating stimuli will not be there, the absence of irritating stimuli is called as comfort. So we'll see about the comfort devices. Those devices are giving comfort. Here we are talking about the patient only. So these are the mechanical devices which are planned to provide. We are planning according to the patient condition, right? So these are the mechanical devices planned to provide optimal comfort to an individual, that is called as comfort devices. So here we'll see several types of comfort devices. Here I mentioned the list of comfort devices. We'll see one by one. I mentioned total 16 comfort devices: pillows, backrest, bed cradle, cardiac table, mattresses, trapeze bar, footboard, trochanter rolls, sandbags, side rails, vase or abductor pillow, knee rest, bed blocks, air cushion, rubber and curtain rings, hand rolls. So these are the list of comfort devices. So we'll see one by one. Here all we know: pillows. Why we need to use pillows? Are used for the support to maintain correct body alignment for the patient. Here only we are talking about the patient. Okay, we are using these comfort devices. Pillow is the first comfort devices we are using for give support to maintain a correct body alignment of the positioning of the patient. We can use this pillow under the head, arms, legs and along spine or abdomen to provide comfort to the patient. Next we'll see about the backrest. Backrest, here these are the pillows, all. We'll see next backrest. Backrest we are using for supporting the patient's back at an angle so that he may maintain a sitting position, and he can be the back rest can be adjusted to desired angle. So according to patient need we can adjust. Okay, the backrest we can adjust. Extra pillows are needed while we are using backrest. We need extra pillows for support. Arms of patients are well supported. While we are using backrest, we have to place the pillows under the arms used for patients suffering with a cardiac and pulmonary distress. So if someone is having any cardiological problem or pulmonary lungs related disorder, so we are using this backrest for those kind of patient. So why it is necessary? It will backrest we can use for relieving the dyspnea that medical terminology. Breathing difficulty, those are having breathing difficulty, then it will help to promote drainage from abdominal cavity. If someone is having abdominal drainage, we can use the backrest which will help to promote drainage from the abdominal cavity, and it will also helps to provide a comfortable change of position. So these are the purposes of backrest. This is the backrest. Here you can see, and how to use for the patient. Exactly back of the patient, and it is making an angle. Here you can see. So next we'll see about the bed cradle. Bed cradle is a frame used to hold the bed linen from touching the patient. Okay, so we are not putting the bed linen like a bed sheet, a blanket. We are not putting over the patient skin or patient body. We are putting all the bed linen over the bed cradle. In case of bone, right? So in that type of cases, we can use bed cradle for keeping or putting the blankets and all bed linens over the cradle. So cradle is it is having two frame, semicircular and rectangular. It is made up of metal, wood and bamboo. Why we need to use bed cradle? It will help to prevent the pressure from the weight of linen, and it will allow the air to circulate around lower limbs, which will help to uh, heal. It will help to stimulate the healing process of the patient, especially those patients are having bone and those are having body pain like muscle pain or joint pain. So you can see this is the same, this is the semicircular bed cradle and this is the rectangular bed cradle. We are keeping the bed linen over the bed cradle. We are not putting over the patient's body. We are keeping over the bed cradle only. Next we'll see about the cardiac bed. Cardiac bed table, you can say it is a bed table placed in front with a pillow on it. Patient can lean forward over that table and take rest. So the main purpose to take rest, lean forward over that cardiac table and he can take rest over that table. Without pillow is used for writing and meals also. So sometimes you can use the cardiac table for writing and taking meals. The patient can use for patient with a cardiac condition. If someone is having cardiac diseases and breathing difficulty or pulmonary disorder like asthma, so they can use this cardiac table. Position should be changed to relieve the fatigue. Purposes like a patient can rest over the table with the help of pillow. He can helps. It can helps to take meals or in writing. As I said, this is two kind of cardiac table we are using for the patient who is having cardiac diseases or pulmonary related diseases. Those are having breathing difficulty, they can use to sit, to take rest, uh, to sit in a lean forward and take rest over that cardiac table and writing purpose, taking meal purpose. We can also use this cardiac table. Next we'll see about the matrices. Mainly matrices are here we are using two types of matrices, air and water matrices, accounting as comfort devices. So it will help to provide comfort. Matrices are using for provide comfort to the patient and also used for very thin person or very obese, those are very fat patients. We are using these kind of mattresses for those patients, and those are having risk to getting the bed sore. Those patients like unconscious patient or like a geriatric patient, those patients are having paralyzed. So in that case you can use the mattresses, these kind of mattresses for preventing the bed sore. Those are laying on the bed for a long period of time, they may have chance to getting the bed sore. So in that case we are using this mattress for preventing the bed sore. Next will this, you can see that this is called air mattress, this is called water mattress. Next we'll see trapeze bar. So this is a bar is suspended from an overhead frame to head of bed. So over the head of the bed it is attached with that. Why we need to use this bar? They use for grasp the bar to raise the trunk of the bed surface or to move up in bed. So they are using, patient can use trapeze bar for moving their body, moving the trunk part of the patient over the head without any help, anyone's help. They can use this trapeze bar for moving their body over the over the bed. This is the trapeze bar. Use an overhead trapeze to move in bed. Next we'll see about the footboard. Footboard is a device that is placed towards the foot of patient's bed to serve as support for his feet, usually made up of wood, plastic, heavy canvas. So footboard is made up of three kind of material: wood, plastic and heavy canvas. Why we need to use? We are using for the patient for supporting the patient's feet and preventing the foot drop. So this is the footboard, you can see in the picture. Next we'll see about the trochanter rolls. Trochanter rolls is a cotton bath blanket sheet which is folded lengthwise to width, extending from greater trochanter of humor to lower border of popliteal space. So why we need to use trochanter rolls for the patient? It will help to prevent the external rotation of the legs. Those patients are having paralysis or those patients are unconscious. For them, especially we are using this type of comfort devices for preventing the rotation of external rotation of legs when the patient is in supine position. So we can see the picture here. This is the femoral head, this is the femoral neck area, and this is the greater trochanter area. So here we have to fold like this, and we have to keep the trochanter. We have to make the trochanter roll by using a bath blanket. We have to fold outward directions for keeping the leg or for preventing the legs external rotation of the legs for the unconscious patient or for the paralyzed patients, those patients who don't have any control over their legs. Next we'll see about the sandbags. Sandbags, by its name you can understand sand bags. In that bag sand will be there, right? So they are sand filled plastic bags. It is made up of plastic. Inside we need to fill the sands that can be saved to body counters and can be used in place of in addition to trochanter rolls. Okay, so here in addition to trochanter rolls we can use the sandbags for giving the shape to the body counters for the patient. Why we need to use the sandbags for the patient to provide support and safe to the body. Then immobilize extremities, mobilize and immobilize, that we should not move sometimes, and in some cases we should not mobilize the extremities, like in case of fracture and all, bone related diseases. In that case we should not move. Doctor will prescribe that we should not move that area. So for that we can use the sandbags for immobilizing that part or maintaining the specific body alignment of that part. So here you can see the pictures. These are made of a plastic and filled with the sands. We are using for giving the shape, for maintaining the specific body alignment and immobilizing the extremities of the patient. Next we will see about the side rails. The side rails we can use, these are the bars positioned along the sides of the length of the bed. We are using side rails to preventing or ensuring patient safety, preventing the patient's fall from the bed, and we are using these are useful for increasing the mobility. It will help to provide assistance in rolling from side to side or sitting off in a bed. So they can use idols for sitting on the bed, and they can use we can use idols for preventing the falling of the patient from the bed. So this is the side rails. Here you can see the pictures. Uh, the both side of the bed we are using side rails for the patient safety purpose. Next we'll see the waist and abductor pillow. Waist and abductor pillow is made up of triangular set pillow. So we are talking about waist or abductor pillow. It is a triangle shaped pillow made up of heavy foam. It is made up of heavy foam, and we are specially using this abductor pillow for the hip replacement surgery patient. Okay, we are maintaining the legs by using this abductor pillow in an abduction position. This is the abductor triangular shape made up of heavy foam pillow, where we are maintaining the abduction for those kind of patients who are having hip replacement surgery. Next we'll see about the knee rest. Knee rest, by its name you can understood, I think. Knee rest, this is a comfort device which placed under the knees to provide comfort to the patient. If someone is having knee pain or tendon beneath the knees, those tendons are there, the patient is having pain. In that case, we can give the knee rest, which will gives relaxation, and thus it will help to relieve the pain from the tendons area beneath the knee. Here the knee rest, you can see the knee rest, the patient can rest their knees over the knee rest like this. Next we'll see about the bed blocks. Bed blocks are made up of wood or metal. It is available. And why we need to use the bed blocks? These are used to raise the foot end. If the bed height is lesser, so in that case we can use these bed blocks for raising the foot end and head end of the bed. So these are the bed blocks. 4 legs are there of the bed, that 4 bed blocks are there, we can use for raising the height of the bed. Next we'll see about the air cushion. Air cushions are made up of rubber, or it can be inflated with the air. So it is made up of rubber material, and we have to inflate it with the air like a balloon. So mainly we are using to take off the weight of the body and to relieve the pressure on certain parts of the body, especially those patients are having risk of getting bed sore. In that case, we can use air cushion for taking off the weight of the patient's body, and it will help to relieve the pressure on certain parts of the body. So this is the air cushion, which is made up of rubber, and we have to implement it with the air. Next we'll see about the rubber and cotton rings. These are also circular rings made up of rubber. This is also made up of rubber, and it also available in a cotton material. So we are using same thing for take off the pressure of the or weight of the patient body. Okay, these are used to relieve the pressure on certain part of the body like elbow or heels. Here we are using these rubber and cotton rings for particular areas like elbows and heels, joint area, for taking of the pressure, relieving the pressure from this area. So here you can see the rubber rings. This is in circular, made up of rubber, circular shape. This is cotton ring made up of cotton. We are placing beneath or under the knees or joint area for relieving the pressure from that area. Next we'll see about the hand rolls. So it is made up of folding a washcloth in half. We have to make it by using a washcloth in half. We have to roll it in a lengthwise, and we have to securing roll with tape we have and we need to place it place it against palm or surface of the hand of the patient. So why it is necessary, why, what are the purposes of hand rolls, why we need to use this device? It will help to maintain the thumb in slightly abducted or in opposition to fingers. So the main purpose to maintain the abduction or thumb in slightly abduction, alignment, maintaining the finger alignment and maintaining finger in slightly flexed position. We have to make it by using a washcloth in half. We have to roll it and secure with a tape. This is the hand rolls. So this is the washcloth. We have to roll it and we have to secure it with a tape. And after securing with the tape, we need to make the patient to hold it up. It will help to maintain the finger alignment of the patient. Those patients are having unconscious or paralyzed. In that case, we can use this kind of comfort devices. Okay, for today, topic is finished. We'll see in the next class with another new topic. Thank you all.